Hey guys, how's it going? So today I'm gonna be talking about masks. I've been kind of avoiding doing any videos like this, um, but this whole mask issue seems to be getting more and more aggressive and getting more and more out of control. And frankly, it's starting to frustrate me a little bit. Um, so I just decided that I'm gonna do this video. I'm kind of compelled to give my opinion, give my thoughts on it. There's lots to talk about. So before I do that, I just want to kind of full disclosure. If you followed me and watched all the stuff I've been posting about and things like that, then you'll know my position on masks. You'll know I'm not a fan. I don't wear them. I don't. I certainly don't mask my son. Um, I'm not into it. But having said that, my position on this is I'm pro-choice. So, I think you should have the choice. If you want to wear the mask, you should wear it. If you don't want to wear it, you should not have to. So I'm not on the extreme where, just because I think that the masks are counterproductive or not helpful or whatever, we're going to get into all that. But just because that's my opinion doesn't mean that I would impose that on you or think that you shouldn't or ridicule you for wearing it. Um, do you? That's how I feel about that. So I'm going to certainly talk about masks here in this video. I'm going to explain all the things that I've been seeing and all the reasons why I feel the way that I do. This is not to shame you for wearing it or anything like that. Honestly, I want to advocate for people who don't want to wear it, why they don't want to wear it, such as myself, and kind of give you some information that maybe you're not seeing on the mainstream media that can kind of get into why this is maybe not the best strategy that we're using. So before I start getting into it, for those of you who don't know who I am not a doctor, and frankly, I don't think that I need to be. So, I feel like sometimes we put doctors on like a pedestal and think that they know everything and that whatever they say, we should just follow it and not question it. And that is wrong. You should not do that. I certainly don't do that. I have a lot of faith and confidence in myself and my own ability to read and listen and gather information and draw my own conclusions based on all the evidence. And I think that I'd like to encourage more of you to do the same thing. Just because a doctor tells you to do something doesn't mean that they're right. They're not right about everything. They're human. And I can oppose a doctor. That's okay. And frankly, there are many doctors who agree with what I'm about to say. So just because you see doctors that are hand selected to be on the media and give, the opinion that fits the narrative doesn't mean that that's the only information, that's the correct information. So just try to get yourself out of that mindset. And there are hundreds of doctors out there, if not thousands, who aren't fans of this whole mask stuff and a lot of the protocols and strategies that we're using to fight this virus. I may oppose doctors that you're used to hearing, but that doesn't mean that there's no scientific evidence or that I'm anti-science. I'm certainly not. I've listened to doctors on multiple sides of this, and I've drawn my own conclusions. I suggest that you try and do the same thing. And let's be honest, okay? The medical experts that have been leading the charge on this thing, they've not done a very good job. Let's just be real. They've been all over the place. They've said things and then contradicted things. So, I don't think that there's anything wrong with questioning what they're telling us and looking into it and keeping them on their toes and, putting their feet to the fire. I think we should do that. There's too much at stake not to. And there's a lot at stake. And I'm not just talking about the virus. I'm talking about all these decisions that we're making in order to try and prevent death from this virus and all the consequences that are going to come with that. So that's, probably a discussion for another day. I'll get into probably that some other time, but let's just be real here that Tony Fauci and Bill Gates and everybody else out there who, we're meant to just follow. They've been a little bit all over the place, and they've been kind of an embarrassment throughout all this. So we're going to talk about lots of things, but today I really want to just get into masks. So at the start of all this, they were actually telling us not to wear the masks. If you remember that. So Tony Fauci, when he was on 60 Minutes, we heard the Surgeon General say not to wear the masks, telling people to stop getting masks. The World Health Organization told us that it's not necessary to wear masks. In fact, the World Health Organization still thinks that we should not be wearing masks unless we have the virus or we're taking care of somebody who has the virus. So they're still on that, and yet here we are still doing what we're doing. So, but since then, Tony Fauci's come out and flipped 180 degrees on that. Everybody is telling us we got to wear the masks. So why are they telling us this? At first, the idea was that the masks were supposed to somehow protect us from getting the virus. But that's no longer the reason, right? The reason that we're told to wear the masks now is because we're supposed to wear the mask to protect other people from getting the virus from you. So if you're wearing the mask and you have the virus unknowingly, presumably, then the mask is going to stop you from infecting another person. So here's the problem with that. See, I never bought into this whole asymptomatics are driving the spread thing. There was always something that stunk about this theory, and the more time goes on, the less that seems to make any sense, and the more I'm validated in believing what I initially thought. Okay, so if you have symptoms, if you're coughing, let's say, then yes. Okay, you're going to likely infect somebody if you go out in public, right? You're coughing, you're spreading this thing around, you're projecting it out, right? If you don't have symptoms, if you're not coughing, you're not going to do that, okay? Unless you're somebody who's really rude and inconsiderate of others, and you're getting right up into their personal space. Like if you're going face to face with somebody, like a close talker or something like that, you're just not gonna spread this thing to people. Okay, you're not gonna project out hard enough, far enough. You're just not gonna do it. If you're keeping distance for the most part. If you're not getting your face up in other people's faces, you're just not going to do it. Even if you do have the virus asymptomatically. Okay. But this was the whole reason that we're doing this mask thing, right? It's like, oh, well, you might have the virus and not know it. So you've got to stop spreading it to other people. You're not doing that. You're not doing that in public. And in fact, the World Health Organization came out not that long ago and told us that by all available evidence that they have, that the asymptomatics are not driving the spread of this. So what are we doing, right? If the World Health Organization says that it's very rare, and this is what was said, that asymptomatics ever infect people, based on, they have a subset of studies, right? So this lady from the World Health Organization, she did a press conference and she said they've, based on a subset of studies and based on unpublished, ongoing investigations around the world, it is very rare, based on all available evidence, that asymptomatic people are infecting people with COVID-19, right? Now, the next day, after everyone was starting to talk about this, she kind of sort of walked that back, but she didn't really. And I'm going to play the clip of her talking about this because she doesn't really. She kind of like re-explains it a little bit and says that she was just talking about this small subset of studies that she was saying. Plus, again, as she said, these unpublished ongoing investigations around the world where there's no evidence that this is actually how this is spreading. Right? And then she kind of says, But we have these models and estimates that say it could be as much as 40%. So, okay, we're going to ignore actual data and information that we have, and let's pretend that these models, because that's gone really well this year, is following models and estimates, by that we can say up to maybe 40%. But based on actual evidence that we have, it's not happening.
What proportion of asymptomatic individuals actually transmit? So the way that we look at that is we look at these individuals need to be followed carefully over the course of when they're detected and looking at secondary transmission. We have a number of reports from countries who are doing very detailed contact tracing. They're following asymptomatic cases, they're following contacts, and they're not finding secondary transmission onward. It's very rare. And much of that is not published in the literature. From the papers that are published, there's one that came out from Singapore, looking at a long-term care facility. There are some household transmission studies where you follow individuals over time and you look at the proportion of those that transmit onwards. We are constantly looking at this data, and we're trying to get more information from countries to truly answer this question. It still appears to be rare that an asymptomatic individual actually transmits onward. I was referring to yesterday in the press conference were a very few studies, some 2 or 3 studies that have been published that actually try to follow asymptomatic cases, so people who are infected over time, and then look at all of their contacts and see how many additional people were infected. And that's a very small subset of studies. And so I was responding to a question at the press conference. I wasn't stating a policy of WHO or anything like that. I was just trying to articulate what we know. And in that, I used the phrase very rare. And I think that that's misunderstanding to state that asymptomatic transmission globally is very rare. What I was referring to was a subset of studies. I also referred to some data that isn't published. And this is information that we receive from our member states through either presentations that they give at member state briefings or presentations that are given to us through teleconferences. As you know, and as we've said previously, we convene global expert networks. And at many of those, we discuss a lot of ongoing research, ongoing studies that are there. And I was referring to some detailed investigations, cluster investigations, case contact tracing, where we had reports from member states saying that when we follow asymptomatic cases, it's very rare, and I use the phrase very rare, that we found a secondary transmission. What I didn't report yesterday was, because this is a major unknown, because there's so many unknowns around this, some groups, some modeling groups have tried to estimate what is the proportion of asymptomatic people that may transmit? And these are estimates. And there's a big range from the different models, depending on how the models are done, and where they've done, from which country. But some estimates of around 40% of transmission may be due to asymptomatic. But those are from models. And so I didn't include that in my answer yesterday, but wanted to make sure that I covered that here.
Okay, so you just saw those 2 videos, those 2 statements. So she, they're taken 24 hours apart. Basically, in the first one, she's saying that the asymptomatics are not spreading this. It's very rare, is what she said. And then 24 hours later, she walks it back. I mean, this is what the media has been reporting. It's a total 180. I don't see that when I'm listening to that. I don't know about you, but if you listen to both statements, they sound a lot alike. It sounds like she's trying to carefully say that, it actually is very rare. Look, she explains that there's a small subset of studies. I said this before. And a bunch of other unpublished evidence that they get from all over the world. And everything that they have in terms of actual evidence shows that this is very rare. They're relying on modeling and estimates to, suggest that it could be more than that. I mean, come on, guys. Come on, seriously. You have to analyze things for what they are. And if you can't even imagine that the media does whatever it can to play up fear and to use that as a control tactic. You're purposely closing your eyes to it. Like, it's right there in front of you. So look, it doesn't sound to me like she walked it back that much. She kind of restated the same things, except that she added, these models. And who cares? Like, the models are models. They're pretend. They're guesses. They aren't based on real evidence. Look at what happened with Neil Ferguson. They told us that we're going to lose millions of people in America over the COVID. And this is why we even got into this lockdown and all this stuff, right? So I'm sorry if I don't buy into models when I have data. Who cares what models say? I mean, honestly, you can put a little bit of weight on that, but for crying out loud, we have data, right? Like, models have failed us epically this year, right? Neil Ferguson, the Imperial College model, that was what created all the panic. This is how this all started to begin with locking down and shutting down businesses and everyone panicking, thinking this is the plague and everything like that, which we now know it's not even close to that, right? This was based on models, and models have been historically off by a lot, and yet we continue to put weight on them. I mean, look, you can put weight on them only for so long and only for so much. The fact of the matter is the evidence is speaking for itself. Look, this isn't new. We're in July now. This has been around for a while. The official story is that it started in November in Wuhan. There continues to be evidence coming out that this may have started earlier than that. I think the last thing I heard is that there was some water tested in Barcelona that showed that it's been here since March of 2019. So, I mean, what are we doing? Well, this virus has been spreading. This super contagious virus has been out and about since March, even if it's been since November of last year. We're in July. This has been going on. This idea that we're going to stop the spread by wearing masks now in July and lock things down back, like we're seeing in the States, some of the places starting to close down again. Like, wake up. This makes no sense at all. None. Stop following models. So another thing that's worth noting is, look, New York was the place that got hit the worst in the world. Okay, and if you're one of these people who believes religiously on this mask and the fact that this is gonna make or break, I mean, look, let's look at New York. Okay, New York was hit the worst. New York, 66%, they announced, Governor Andrew Cuomo came out and had a press conference when he was given the data. 66% of the spread in New York came from people at home. It came from people at home. It was not from out in public. It wasn't because people weren't wearing masks and going out in public that this thing was spreading. 2/3 of the people got infected from at home. You're not wearing your mask at home, are you? You're not. You're at home. You're told not to. You still don't. I guarantee you're not wearing your mask at home. So what is this doing? What is this doing? If asymptomatics, if the World Health Organization has told us that asymptomatics are not the ones who are spreading this, why are we wearing masks in public? And if all of available data shows us that the majority of the spread is happening at home, what difference does it make if you're wearing this mask outside? When you're out in public, when you're at the grocery store, whatever. Are you wearing it at home? Are you going to sleep with it? Are you curling up on the couch with your kids and all wearing masks? Like, no, you're not doing that. And this is what I've been saying. It's because if you're out in public and you're wearing this mask, whether you're wearing it or not, you're not getting in people's faces. When you're at home with your family, you're going to get closer to your kids and your spouse. So this is a situation maybe where someone who's asymptomatic or more likely pre-symptomatic, where you're just starting to get symptoms, and you're close to people you love, and that's That's how spread happens. In New York, 66% of the spread came from people at home. 18% came from the nursing homes. Okay, and if you don't know about that, New York was one of these dumbass places that forced people with a positive test, elderly people, to go back into the nursing homes, which was ridiculous, right? But that's where the most vulnerable people were. And New York was basically shoveling infected elderly people into nursing homes and causing the spread. So 18% came from that stupid idea. 66% came from people at home.
This is a surprise. Overwhelmingly, the people were at home, where there's been a lot of speculation about this. A lot of people, again, had opinions. A lot of people have been arguing where they come from and where we should be focusing. But if you notice, 18% of the people came from nursing homes. Less than 1% came from jail or prison. 2% came.
I want to talk about flattening the curve because I think that's relevant to all this, okay? Flatten the curve. That was the big catchphrase several months ago when this started to attack North America, Canada, and the US. We've got to flatten the curve, flatten the curve. We still hear people saying that. It blows my mind. It's a catchphrase. The media does this all the time. Sound bites. They repeat things until you just repeat it yourself, and you don't even know what it means anymore. What was flatten the curve? If you don't know what this is, go back in time a little bit and look it up. Flatten the curve was never to stop the virus. You cannot stop the virus. You can't do it. The only way the virus stops, theoretically, is if you have an effective vaccine that you give to everybody and then everyone is safe from the virus. That's a real nice theory. It doesn't work that way. This is the real way that you do it, is you infect people, man. That's the way that you get rid of this thing. Flatten the curve. The idea of flatten the curve was we want to, remember this was supposed to be a 14-day lockdown? That was what we were doing, flattening the curve. Not forever. That was never the goal. The goal was to get our hospitals ready so that they could handle this when it did come. So we tried to slow it down long enough to get all the PPE and get all the ventilators, which didn't help all that much to begin with. So we get everybody all loaded up, PPE, ventilators, hospital beds, get the ICUs, build other hospitals in parking lots because we're going to have all this massive death happening. This was the whole idea of flatten the curve, was to try and control the spread long enough so that the medical resources, the medical professionals would not be overwhelmed. They'd be able to handle it when people started getting this thing. We're in July. We're still hearing people talk about flatten the curve. Hashtag flatten the curve. Like, give me a break, man. Give it a rest. This is not flatten the curve. This is not flatten coronavirus. This is not, you're going to avoid the virus for the rest of, the rest of time. You can't do that. The virus is not going to go away just like that. Just because you hide in your home. It's spreading, man. This is not how you do it. So flatten the curve was never meant to be this permanent solution to kill the virus. And we're still acting like that. That's what this mask thing is. It's like a recycled version of flatten the curve. You're being told to wear this thing to protect against other people. What are you talking about? The virus is there. It's out there. You're not going to stop it. Now, look, I'm not suggesting be completely reckless about it. Be smart about it, right? Obviously, if somebody is vulnerable to it, like we've been at this for a while, okay? Yes, young people can be hurt by it too. But in virtually every single case, if a young person is harmed by this or killed by this, they have some other underlying condition every time. So If you're old, if you have asthma, if you are obese, if you have any of the listed comorbidities, take care of yourself. Be cautious. And if you know someone like that, be cautious in your interaction with them, right? I get that. But this idea that all the healthy people out there have to wear masks in public with each other to stop the spread, we have to stop this idea that we're going to stop the spread. This is wrong. This is not how you defeat any contagious illness like this. This is not how it's done. You don't try to hide from it and stop the spread, especially something this weak. Like, can we talk about the fact that 99.7% of people survive this? The CDC came out with this very recently. I think it was in May. Okay, in May, the CDC revised the mortality rate of coronavirus to 0.4%. 0.4% of people, of reported cases, die from this thing. Reported cases. So that doesn't include all the people who are not reported. All the asymptomatics and all the people who got it couldn't get a test for it. Remember back at the beginning when you couldn't get a test for this thing? It was impossible. Even if you had symptoms, they were so scared that you were going to overrun the hospital with to flatten the curve that you couldn't get a test for this thing. Do you remember that? You had to lie and tell people that you came from out of the country or that you were involved with somebody who came from out of the country. That was the only way you could get a test for this thing. So how many people do you think at the height of this thing got it, maybe got mild symptoms or none at all, and so they were never tested for it? How many of those do you think there are? There are tons. So the CDC, based on reported cases alone, come up with the 0.4% mortality. And then they estimate that if you factor in the asymptomatics, that it's closer to 0.26%. Now, look, I think that it's way lower than that. I do. I know it is. They're being very, very conservative on how many people they think got it that didn't report it. If that's it's only dropping that much, that's a joke. And in fact, in late June, the CDC revised this. They actually came out with a report saying, we actually think that the number of infected is 10 times higher than we initially thought. 10 times higher. So if you're looking at 0.26% as your mortality rate based on this conservative guess, and then you realize, oh, this is actually 10 times more people out there will have this, so that would make this 10 times less deadly. You'd be looking at, what is that, 0.026% mortality? I mean, what are we doing? And that's with the deaths, the counted deaths, the way that the CDC is counting them. Okay, let's not forget about the fact that every person who dies with coronavirus is being counted as died by coronavirus. So it doesn't matter if they had comorbidities. There's other things that they were going to die anyways. These people are falling under the count. Okay? And, interestingly, George Floyd, who there's all this stuff going on about, he was tested. And he tested positive. And it's on his death certificate. So I guarantee you that was counted. Okay, so stuff like that, dude, this guy did not die of coronavirus, but it's on his death certificate. Okay, and there's another video going around, there's a documentary about a nurse who's from Tampa Bay. I can't remember her name. I'll try to find it. From Tampa Bay, who worked in New York, and she went undercover and she started recording stuff because they were lying about people dying from COVID. putting it on even with multiple negative tests, putting on the desk. So anyways, to say there's a way higher death count than there's supposed to be. That's obvious. If you don't see that, you're deliberately not seeing that. Okay, this death count that you're seeing in the States, 135,000, whatever it is, that is baloney. Okay, that is malarkey. That is not true. There's no chance it's that high. And I guarantee you, if CDC does become honest with itself, they will come out with it down the road and revise that and say, you know what, it's actually a lot less. Okay, a lot less from 0.26%. From 0.026% if you count this 10 times higher that they announced, that they reported. So what are we doing? We're flattening the curve still. That's what this mask thing is for a disease that kills almost nobody on its own. That, you know, we're in July now. We have treatments for this thing. Like, do you guys still not know that there's vitamin C, vitamin D, hydroxychloroquine? This thing works, man. If you're just reading headlines about this hydroxychloroquine, man, like, stop doing that. Okay, every one of these articles trying to poo-poo on hydroxychloroquine, it's garbage. That stuff is working. Saying that it's dangerous, what are they talking about? This thing's been around for 70 years, man. People who take it every year, do you know how many people take it in the States? In the millions. Millions of doses of this thing every year, because people take it for lupus, they take it for rheumatoid arthritis, they take it for malaria. People have been using this for 70 years. All of a sudden, now there's this, oh, it's dangerous, can do this, can do that. No, that's BS. That is a lie. They're saying these things. You know why? Look, it's because Donald Trump said that he liked it. That's why. Let's be honest. The media attacks him for everything. Sometimes rightfully, but a lot of the time it's a joke. The media's a joke. Donald Trump said that he liked hydroxychloroquine, so it's got to be the devil. It's not. If I was sick with this thing, I would get that. I would get that hydroxychloroquine protocol, Dr. Raoult, using the zinc and the azithromycin. There's no, man, Dr. Raoult in France, he is treated like 2,000 people or something like that. And like, he has an over 99% recovery. If you do this properly, you can recover from it. It's not dangerous. And we're talking people who are hospitalized and in serious trouble, right? Most people don't even get to that. Most people don't even come close to that. So many people don't even know they have it. This is what we're dealing with. We're shutting everything down. We're wearing masks. It's BS.